Vice Chair of the British Caribbean Doctors and Dentists Association. And just before we started, I just thought I'd let you know a little bit about us. So we were formed in November 2019 by our founder, Dr. Rochelle Pierre. And it was a way of getting a group of doctors, dentists from Caribbean heritage together as a way of kind of supporting each other through our training. We've since grown quite big since then, and we do a lot of work, including outreach work with young people and in primary and secondary schools and for youth groups as well, as a way of encouraging children and young people from Caribbean backgrounds into medicine and dentistry. We also have a professional development arm where we help our members to improve on their career prospects, where we hold monthly workshops with regards to increasing leadership and mentorship, and also improving skills in helping us to achieve positions in higher ranks within the NHS and within healthcare. Another arm to our group is that of health promotion, and this is one of our events today. We know about the inequalities with regards to healthcare with Black and ethnic minority people, and we're all about improving the health of our community and also increasing health literacy within our community as well. We do have a number of events throughout the year, and someone within the chat will let you know about our social media handle, so you can follow us and keep up to date about other events that we will be having. If anyone would like to join us, then please send us an email as well. Our future goals are to try and establish some sort of funding for students who would like to study dentistry and medicine, whether that be here or abroad back home in the Caribbean. Of course, we will need your support and would very much appreciate your support for that. We are a not-for-profit organisation, and any donation that you'd be able to help us with, no matter how small, will be very much appreciated. So this event tonight is in collaboration with the Budding Black Dentists, and I will hand you over to Simi, who will tell you more about them.
So hi guys, my name is Simi, or Simisola, that's my full name. I am the founder of Budding Black Dentists. This is a non-profit organisation which is dedicated to promoting diversity in dentistry. So this initiative was actually sparked by the noticeable lack of Black representation in dentistry, with only 2% of registered dentists in the UK identifying as Black. So our mission is to support and establish a network of Black dental applicants, students and qualified professionals whilst promoting oral health awareness, especially in the Black community. Yeah. So yeah, I think I'll take it back to the host.
Hi everybody, thank you so much for coming. I'm Dr. Jada, I'm one of the Black Caribbean doctors, British Caribbean doctors and dentists team members, and I'll be hosting for you this evening. So I'd like to welcome you all. Thank you so much for coming out this evening. I know it's Saturday evening, and obviously although we're in lockdown, we still have things that we could have been doing. So we're really grateful that you came, and we have so many fantastic speakers and some information for you this evening. So today is World Oral Health Day. And it also coincides with the UN Anti-Racism Day today. And that's actually quite important because oral health is something that, as with other areas in healthcare, we see disparities between the Black community and other communities. So even in England, Black people are less likely to get access to oral health, and as Simi mentioned, we don't have as many black dentists in proportion to that we have to Black people in the population. So it's really important that we take this time to focus on our oral health. And so thank you all for coming, and I want to introduce our first speaker for this evening. Dr. Kavin Andi is a oral maxfax surgeon, so maxillofacial surgeon, and he's an award-winning surgeon and also a public speaker. And we're really grateful for him taking time out to speak to us today. And he's going to be doing a presentation on oral head and neck cancers. So each of our speakers will talk for about 15 minutes, and then we will have a time at the end for question and answers. So please post your questions in the chat as you think of them, and then we'll have a time at the end for you to answer them. And also, if you're having any problems hearing or engaging with the information, please let us know in the chat and one of our admin team will be there to help you. So without further ado, I will hand over to Dr. Kavin Andi.
Thank you so much, and good evening, everybody. First I've got to say it's a real honour to be here, to be invited by the BCCD to come and speak at this event, and just great to see brothers and sisters all putting together events like this. So absolutely we need more of this, and look forward to participating in the future. Just going to share my screen with you now, and hopefully in a second you should be able to see something. Can you all see that? Okay. Is the screen up? Fantastic. Okay, so that's me, as you've heard, and I wear a few different hats. I'm based at St George's in Tooting, and I also run clinics in Croydon at the University Hospital there, and I've got research interests, academic interests, and I examine the King's College as well. So a little bit about me. I've studied dentistry. I did dentistry first after I ran into a lamppost. That's sort of how I got into surgery. And I was really not that medically inclined or dentally inclined. So my true love was art and sculpture. So through dentistry and learning anatomy, I got a little bit more interested in surgery, and that's what took me to medicine, following which I did some general surgical training in maxillofacial surgery, and then an advanced head and neck national fellowship. So it's been a fun journey. It's still ongoing, and I'm currently in my final year of a Master's in Law degree at Cardiff University, which I'd recommend to anyone who's considering any of these medical dental careers. So my focus today is going to be mainly on mouth cancer, oral cancer. Head and neck cancer is a vast topic, and I probably need 3 or 4 hours to talk through all the rest of it. So we're going to focus mainly on mouth cancer. I'm assuming that we're not, I'll try not to be too technical in terms of some of the language or concepts, because I really want some of the take-home messages to be taken home and remember today. So we'll run through the introduction. Head and neck cancer, these are the latest figures from Cancer Research UK. Nearly 12,500 cases every year of head and neck cancer. Of those, we see about 7,000 to 8,000 oral cancers. So they make up quite a large proportion of cases. And fortunately, about 4,000 people every year will die from this disease. And depending on the stage of presentation, the survival after 10 years, and we've only recently started talking about 10-year survival, is between 90 and 59%. So the odds are not great, and that's mainly because at the moment we have a problem with late presentation of disease, people not recognizing the disease, doctors and dentists not recognizing the disease. The proportion more males than females, although that's beginning to unify. We all know what the common risk factors are. You know, anything that you light up and put in your mouth is going to cause cancer. So that's tobacco, smoking, cannabis in that group. Alcohol in combination with the two has a synergistic effect. Alcohol on its own has a more general effect on the body. Diet, we now increasingly recognize, is really important. And more recently, over the past 5 years, a greater focus on human papillomavirus 16, which is a precursor, has a greater effect in throat cancer than mouth cancer per se. There are some habits such as chewing pan and betel quid that we see in patients from mainly the Indian subcontinent. But of course, we worry about other substances such as cat in the Somalian / Ethiopian community. So this is a slightly older graph, but you can see here the peak is around the 5th decade. And what's worrying is that the latest data is showing this trend is moving towards the younger age group. So my youngest patient with mouth cancer last year was 22 years old with no risk factors. So there is an increasing reversal in that trend there. Males still predominantly more than females as well. Over the years, figures going back to 1975, there's a general uptrend. And that's a combination of things. It's a combination of people being diagnosed more frequently because of advances in medicine, but there's also a general increase in risk due to some of the newly identified pathogens such as human papillomavirus 15. Here, very interestingly, males, again, younger in age group, the younger group, so the blue line here is the 0 to 49 age group. You can see the trend, unfortunately, is on the rise as well. If you look at females, the general trend is up. So this may not be something that you've heard of, but overall, the figures are increasing. Now, if you think about where in the mouth would you tend to see these cancers, again, these are the latest figures, you see that the tongue is the most frequently affected area in the mouth. And I treat a lot of tongue cancer in that regard. But we've got other areas such as the floor of the mouth, the base of the tongue, and the lips, top and bottom, as well as the gums and the palate. So what the data is telling us, so these are the areas that you need to be paying attention to when you're brushing your teeth. Just have a look at the tongue, look inside your cheeks, look at the palate, look around the gums. Is there anything new that's not present on the other side? If it's asymmetrical, it looks unusual, it needs to be checked out. It could be the sign of an early oral cancer. But before we go into oral cancers, I want to show you some of the very common benign lumps and bumps that you may see. Now, you may not have heard of all of these, but these are the sorts of things that come into my clinic on an urgent cancer pathway. Unfortunately, I'm able to diagnose and tell the patients that there's nothing to worry about. So polyps we see are very common. Polyps inside the mouth there, you can see it's smooth and pink. There's nothing angry looking about this. It's a bit like buying a pair of shoes that are too small. You get extra skin laid down. So this may have been caused by some irritation under the gums, some calculus or tartar that's irritating the lining, and it's responded by laying down more tissue because the mouth wants to get away from it. So these are fairly straightforward to diagnose and reassure the patients about. You can see this patient here has got lots of calculus that needs a bit of scaling and polishing. Geographic tongue, again, this can look quite sinister and quite worrying. It's got this sort of edge around the area. You've got red areas. Red always means danger when we're talking about linings in the mouth. But the difference with this geographic tongue, and it's called that because you get these sort of islands of tissue. So they look like islands in that regard. The key thing with these is it moves around, it changes, it's not static in its shape. We don't know what causes it, there is no cure for it, and treatment is symptomatic, but it's very much a benign condition in itself. Orofacial granulomatosis, not so commonly seen. I mean, the chap on the right is an extreme example, but you may get some subtle enlargement of the top and bottom lip. Looks like someone's put some fillers in. But this may be a sign that there's something else going on elsewhere in the body. So diseases of the gut system, the large bowel, the small bowel, they may present with this sign and trigger investigations to find out what's going on elsewhere in the body. Ulcers are very common. I mean, we've all had an ulcer at one point or another. Commonly, they've got this sort of red outline with a yellow base, extremely painful. You have a drink of water and it stings like hell. And they're common if you're particularly stressed, if you're anemic, and so forth. So these tend to heal by themselves within about 5 days, and they don't leave any scars at all. And if you're getting them frequently, it's worth going to the GP to get your hemoglobin levels checked, your iron levels checked, vitamin B12 and folate. Simple blood tests can show if you're deficient. Top up with some supplements, and they'll become less frequent. So the key thing with these is often you see them in little clusters of 2 or 3 as well. Viral infections, again, these are from the human papillomavirus HPV group. They cause these sort of little clusters of lesions. These can mimic cancers. And again, the best thing for these types of lesions to make sure they're checked out under the microscope, because we can analyze these to give a definitive diagnosis to exclude a cancer. Unfortunately, some cancers do present in this way, and these lesions will tend to get bigger and bigger. So it's not something you ought to ignore because it won't disappear on its own. Pyogenic granulomas or epidermis, these are really common. I see lots of pregnant ladies in the first or second trimester. They come to the clinic with a fleshy red lump that bleeds very easily. It looks very worrying. Or a firm, hard lump that looks like a polyp that is a bit more bouncy, as it were. And these are very benign in their nature. Often they don't need a biopsy and they'll regress themselves after pregnancy. So a bit of cleaning under the gums in these sorts of situations helps really well as well. Mucoceles, these happen because of damage to salivary glands. They tend to go up and down, got a sort of a bluish hue to them. I see lots of boxers who come with these, and sometimes they need excision to get rid of them because they won't disappear as well. And ranulas are a bigger version of a mucocele that happens inside of the floor of the mouth. This lady's got a bit of a double chin because it's filled up with a balloon of saliva in that region. And taurite, very common, especially if you're African and Caribbean in origin. The key thing with these are hard lumps. They're bony hard because that's what's underneath them. And they are symmetrical. So you almost got a mirror image, or you find one side as well as a lump on the other side. So those are the common benign lesions. So let's now really focus on what we now term potentially malignant oral lesions. Yes, they've got some medical names in that regard, but in essence, what we're talking about are white patches, leukoplakias, and red patches, erythroplakia, erythro meaning red as well. So white patches and red patches, or mixed red and white, are really warning signs of something that you ought to get checked out by your specialist. So here we have leukoplakia, and you can see that these sort of areas affecting the cheek. Here's an area on the tongue. This one's smooth. It's got these sort of irregular edges. This one is a little bit more subtle. It's a white patch. You can't wipe it away at all, and it remains there. This needs a biopsy, because what I'm really interested in is what's happening to the cells in this area. Are the cells beginning to change? Are they starting to become dysplastic? And if we think about cancer as a spectrum of change, there may be a little cancer hiding in here. So these always need to be biopsied so that we can look at the cells under the microscope to determine whether there's a risk because of cellular change. And if there is, then I do laser treatment on these large areas to reduce the risk. Here's some red patches. This can be very subtle in this area, sort of a speckled patch in this region along the gum, another red patch here in the roof of the mouth. The red patches are 20 times more likely to turn into a cancer than the red patches. So red means danger. Absolutely, these need to be looked at under the microscope. And that will only happen if you get a referral to see your specialist to have a biopsy under local anesthetic. Biopsy is a very simple thing to do. Small injection, get the area numb, you take off a small piece, 2 or 3 stitches, takes 15 minutes, and off then you go, and we get a result within 7 days. So red patches ought to have more attention paid to them. This is infection with Candida. The fungus can induce changes in the cells which produce cancer. So again, important to eradicate it or find out why you're getting it. You know, if I see Candida in the mouth of a man, then I'm worried about immunosuppression or HIV or other conditions. And lichen planus, another benign condition. This has got a very low transformation rate to cancer, less than 1%, or 0.02 to 1.8%, depending on which paper you read. But again, a biopsy to look at the cells is quite important in that regard. Submucous fibrosis, something we don't see in the African Caribbean community often, unless you've been chewing palm and betel nut. It causes this sort of leathery transformation of the elastic tissue. And this is a precursor to cancer as well. So things to think about. Do you have risk factors? If you're a smoker, heavy drinker, you need to pay more attention. Look out for the signs such as ulcers. How long has the new thing been present for? If it's been there for more than a week and it's not going away, it needs to be checked out. So if we look at the lip, if you've been out in the sun a lot and you've got a firm nodule like this is an ulcer that's not healing. Some people might think this is a cancer. If it's there after 2 weeks, sorry, some people might think this is a cold ulcer. If it's been there after 2 weeks, this is probably a cancer. This turned out to be a lip cancer that needed removal. Look in the mouth, you've got this sort of reddish area, speckled leukoplakia, as we call it. This is a precursor to cancer and needed definitive treatment as well. And here you've got, look at this unusual changes. You know, there's no bleeding, there's no pain. Pain is not a symptom. It's got a very granular, angry look. It's red. This is a cancer that needed removal of part of the jaw in order to get rid of it. And here's an ulcer in the tongue, completely painless, but this has been growing for several months. Large cancer here that will require resection and reconstruction. Similar lesions here on the tongue. You know, anyone should be, well, I won't say anyone, but you can tell here that it looks very different to the lining adjacent to it. And similarly here, a big cancer on the right-hand side of the tongue, completely pain-free in that regard. So cancers affect the mouth, the bone. They can burst out into the skin, and this presents a lot of problems, particularly for reconstruction of the area. And we use a lot of imaging to understand the extent of the cancer. So here's a cancer that I've mapped out from a CT scan as part of surgical planning. And if you draw a margin around it, because you have to remove a normal amount of soft tissue, this is a 1.5 centimeter margin. By the time you've planned your resection, you can see that this patient is going to lose a large part of their lower jaw, which is the purple area, as well as a large part of their upper jaw, which is the area coming into view here. So surgical planning and treatment planning for cancer has to take into account putting back all these tissues, skin, bone, teeth, and jaws in particular. So let's just move on. So cancer requires extensive treatment. If you can't catch it early, there's a big cancer here in the top jaw that's going to require removal of the jaw and reconstruction. And here's a cancer that was sitting at the back of the palate that's required splitting of the jaw in order to safely remove it and then reconstruct it. Cancers in the top jaw, we see a lot in people from the Chinese population. These are the worst ones because they grow very slowly. They hide inside the sinuses, as it were. And here's a cancer which I've mapped out. You can see how it's grown inside the top jaw and it's eaten away at the bone. The green is the safety margin for surgical removal, but you can see how the top teeth have been affected. The cheek skin has been affected. The top jaw and the eye are all affected. So this has to be repaired and reconstructed, and we're using the opposite jaw here for the surgical reconstruction. So here's the removal of the cancer, quite extensive in that regard. That leaves a very large defect in the area, but we can put this back by carefully planning how we're going to reconstruct the area. So this is a 3D model from the opposite jaw, which has been mirrored so that we can get the shape of the jaw right. And here I'm removing bone from the leg. This is the lower leg, the fibular bone, which can then shape back into a skin, muscle, and bone in order to reconstruct the area. This is some imaging that I use to plan how much bone I'm going to remove and to work out where all the blood vessels in the region are. We'll just skip that one for now. So here is the leg in the face, recreating the top jaw. Obviously the eye is going to be an artificial prosthesis, and there is the final result after reconstructing the big hole in that area. Other areas, if you've got a spot that's not healing, it's not just from the skin. This is in fact a tumor that is in the jaw, and this is the plan for removal of the entire jaw in itself. You can see that's quite a substantial amount that requires removal. Here's a specimen from the plan. I think they match up quite nicely in that regard. And let's go to the next slide. The computer just frozen there. Bear with me a moment. Let me close that for a second. Yes, so the slide is frozen for some reason, but that was the final slide was demonstrating how you can again reconstruct the jaw using bone and muscle from any part of the body, and often I use the hip, the lower legs, or the forearm for that purpose. So my final slide was essentially to say that, to summarize, in that the danger things to look out for are the white patches, the red areas in the mouth, the red and white mixed areas. These are early signs of cancer. And unfortunately, up until last week, I still see patients who are presenting 6 or 9 months down the line because they've either been falsely reassured by their doctors or dentists, or they've ignored the signs. So it's very easy to check your mouth in the mirror every time you're brushing your teeth. Look at all those tissues, look at your tongue, look at the cheeks, look at your gums, and look at the roof of the mouth. There's 4 important areas so that you can be the one to detect something new if it starts. Thank you very much for listening, and be happy to take some questions a bit later on, I understand.
Thank you so much, Mr. Andi. I think I called you Dr. Andi, but just people who don't know, in medicine, once someone is a surgeon, we usually go back to calling them Mr. So thank you so much for that presentation.
Yes, I'm not a physician.
A fantastic presentation, really interesting. And I'm pretty sure there's some things that people hadn't seen before, definitely things that were new to me. So thank you for that. For those of you who posted your questions in the chat, thank you so much. We'll be answering questions at the end. So we'll be taking questions at the end once all the speakers have spoken. So we're just going to move on to our second and third speakers for the evening. So our second and third speakers for the evening are Miss Fynn-Famodun. I think I pronounced that right, sorry if I haven't, and Miss Jada Britton. Simi is the founder of Black Budding Dentists, and she's a final year student at Plymouth University, and Jada is also a final year student. So I want to thank you so much for coming and agreeing to speaking to us this evening. I'm going to ask them to join us and start the presentation.
Thank you so much for the introduction. So hi everyone, as you already know, I've been introduced for the third time now. My name's Simi, and I'm joined with Jada, who is also a final year student like me. And tonight we will be, oh sorry.
That's all right.
Do you want to introduce yourself as well then?
Yeah, sure. So I'm Jada, I'm a final year dental student at University of Liverpool, and I'm also the BCDD's dental rep.
So yeah, today we'll be talking to you about dentistry and dental myths. Okay, so I'll first be talking about debunking myths. So let you guys know what is fact, what is fiction, you know, whether certain things like fluoride, there's a lot of debate whether that's good in your toothpaste or not, and also what healthy gums look like.
And then secondly, I'll be talking about accessing the dentist. So I think a lot of people, in my experience, have told me they've had trouble finding an NHS dentist. They might also be worried about costs related to the dentist, how far they might have to travel, or even having, you know, dental anxiety maybe from childhood that goes into adulthood. But as dental students and practicing dentists, we are taught, you know, a good dental health is sort of the gateway to the rest of the body, and it's something that everyone should have access to. So we're just going to touch today on how everyone can access that. So going back to the theme of World Oral Health Day, which is today, so just a bit of background. So every year on the 20th of March, it's an event that's run to help reduce the burden of oral diseases. It's to try and educate and empower people with the knowledge and the tools to look after their oral health at home and know when to seek professional help to be able to have top quality oral hygiene. So the theme for this year is to be proud of your mouth. Personally, I thought it was quite a relevant theme. I think for the past year, obviously, we've been in the middle of a pandemic. We've all been wearing masks, and often dentistry feels like sort of a footnote compared to everything else that's going on. But it is really important for people to be mindful of their oral health, to know how to look after themselves at home, and to know what's normal, what's abnormal, and how to seek help. So just some stats for some background. So untreated tooth decay, according to the World Oral Health Organization, is the most common condition globally. There's an estimated 2.3 billion people that suffer with untreated tooth decay globally. That number is probably a lot higher. It's probably based on those who present, and for those who aren't able to see a dentist, obviously it will be a lot higher. But on the flip side, it only takes 2 minutes to brush your teeth. We'd recommend you do it twice a day, once before bed and one other time. And then another common problem is gingivitis, otherwise known as sort of bleeding gums. One of the most common causes is related to plaque on the teeth. And it only takes 2 to 3 weeks to resolve that. It's reversible.
Okay, so Dr. Zara, who's one of the speakers, she's going to be talking about how to look after your teeth at home, as well as some other things. But what we're going to cover is things that are true and false. So we read a lot of things online, we watch a lot of adverts, we get sent WhatsApp chains, sometimes to do with medicine and dentistry. And yeah, we're just here to establish what is true and what is false. So the first myth we're going to be debunking today is whether fluoride is bad for you. So first of all, I'd just like to say how funny it is that we are told about milk, and we truly believe that milk is good, and it helps with giving you strong bones and strong teeth. But there's a lot of debate when considering whether fluoride should be in toothpastes. So part of the reason milk is good for your teeth is the fluoride content, which is mentioned here. So in large quantities, fluoride can be toxic, which is true for a lot of other simple chemicals if they're consumed in excess. People are not usually aware that fluoride is actually present in all natural waters to some extent. To reach the toxic dose of 5 milligrams of fluoride per kilogram, a 5-year-old would need to ingest 63 tubes of adult toothpaste in one go. So it's quite safe. So in terms of the benefits of fluoride, fluoride makes your teeth more resistant to acid attacks, which makes your teeth more resistant to decay. It restores the depleted mineral content of your teeth, and it discourages the demineralization of your teeth. And what I mean by demineralization is the loss of the good minerals that make your teeth strong. So there are different forms of fluoride that are found in toothpaste, and I've listed some of them in the presentation. So sodium fluoride is a common form of fluoride found in Colgate, and stannous fluoride is a common form of fluoride found in Oral-B toothpastes. So if you'd like a cheaper option, instead of buying these big branded toothpastes, you can actually get cheaper fluoride toothpaste in your local supermarket. You just need to make sure that there's the recommended amount of fluoride in the toothpaste. So I've just shown here the amount you should look for in a toothpaste you buy. So I know a lot of people don't actually know where to find out how much fluoride a toothpaste has in the tube. So you just need to look at the back of the tube, and then you'd see a list of ingredients, and yeah, you definitely find the fluoride content in the measurement parts per million. So I've heard a lot of people say charcoal toothpaste makes your teeth whiter. I'm here to say that that is true, but charcoal toothpastes are actually abrasive to your teeth. So what do I mean by abrasive? Abrasive derives from the term abrasion, and abrasion is the physical wear of teeth caused by objects other than teeth. So the only reason charcoal toothpaste make your teeth appear whiter is because it scrubs and wears away the superficial layer of your teeth, which is known as enamel, and it leaves a thinner surface of enamel on your teeth, and then this could lead to tooth sensitivity. So fluoride toothpaste, they may not make your teeth brightly white, but they will definitely strengthen your teeth. So I would say you should use fluoride toothpaste instead of the charcoal ones. If you're looking to get whiter teeth, I would say talk to your dentist about that, and you can discuss the options in regards to whitening your teeth, but they would definitely supply you with a more controlled and less damaging way to whiten your teeth. So toothpicks. I know this is a touchy one because everyone's got toothpicks. I'm sure when you get food stuck in your teeth, you just, you know, the toothpick is the go-to device. So first, I would just like to talk about gingivitis. So this is inflammation of your gums, and it's a reversible form of gum disease. The most commonest type of gingivitis is plaque-induced gingivitis, and this is characterized by the presence of plaque, as you can see here. Plaque is just a sticky deposit that can be found on teeth, and bleeding gums as well, amongst other signs and symptoms. So other than toothbrushing, incidental cleaning aids, so I've talked about what that is here. They're basically devices that you use to clean in between your teeth. They actually help prevent gum disease, and they get into the areas where your toothbrush can't get into. So the commonly known cleaning aids are toothpicks, floss, and incidental brushes. So I actually did a critical appraisal on incidental cleaning aids, where I was looking at the effectiveness of toothpicks and floss. Just for this presentation, I did a little bit more research, regarding the incidental brushes. So when it comes to toothpicks, studies show that they do help in the removal of plaque, but they do not help in the resolution of bleeding gums. And in regards to floss, that resolves bleeding gums, but it doesn't get rid of the plaque in between your teeth. So with incidental cleaning aids though, with incidental brushes, they actually kill two birds with one stone. So I would say they are the gold standard, and NHS also agree with me. So they've mentioned on their website that incidental brushes are the go-to, and if you can't get access to incidental brushes, then you should use floss instead. Other than the evidence that shows the efficacy of incidental cleaning aids, I would say the misuse of toothpicks can have implications. So, if you misuse a toothpick, it could lead to trauma to your gums, it could traumatize your teeth, and also it can leave splinters in between your teeth, which could lead to an infection down the road. So I know before dental school, all I ever knew was toothpicks. They did the job. But I would say, I know that they're more easily accessible. I know that they're cost effective. I know they're easy to use. But I would say the best practice is to use incidental brushes. If you're going to use a toothpick, I'll just say that you need to know that, you need to make sure that there's enough space in between your teeth to put the toothpick in and take it out so you don't leave any splinters. Okay, so brushing your teeth harshly. This is what I'm going to cover now. So people tend to think the harder you brush, the cleaner your teeth. This is usually complemented with the idea that you need tougher bristles to brush your teeth. So I know lots of people buy the smoker's toothbrush. I know that people think if you brush your teeth for hours, then you get cleaner teeth. Yeah, so I'm just here to say that that actually does more damage than good. So This would be termed as overbrushing, and overbrushing refers to brushing your teeth too vigorously or too often. And this is the most common cause of dental abrasion, which I've noted before. And yeah, I'd say definitely apply less pressure when brushing your teeth as well. And you don't need to use a hard bristled toothbrush to get the gunk off your teeth. You can use the soft bristled toothbrush. And yeah, I would say this is why dentists recommend that you brush your teeth twice a day for 2 minutes. So once before you go to bed and another time during the day. Okay, so my gums are black. That's not normal, right? So a lot of people have been referred on to, I would say, maxillofacial surgeons like Dr. Andi, because they have patients who present with darker gums. So if you are a dark-skinned individual with pigmented gums and you're otherwise healthy, then there's most likely nothing wrong with you. I would say the term black gums basically means that your gums are dark brown or purple, and this can be completely normal. The darker pigmentations can be generalized, as you can see in the photo, or you can just have areas of darker spots on your gums. You should only be concerned if there's the presence of new pigmented areas, and if there's a change in the texture or the size or the color of the pigmentation. So to rule out other disorders or diseases, I would say you should check to see that you're experiencing the symptoms of the suspected disease. So for example, hyperpigmentation of your gums can be a symptom of Addison's disease, which is a disease to do with your hormones. So to rule this disease out, I would say you should check for other symptoms. So for example, muscular weakness, tiredness, or weight loss. And now I'm gonna hand it over to Jada.
Okay, so this section is looking more at accessing the dentist, how you're able to find a dentist close to you and what they can offer. So the first option is a primary care dentist. So this is sort of your regular dentist that you might find on the high street or in your local area. In terms of what they can offer, it's listed below. So it's sort of general examinations, fillings, cleaning for the gums, and a lot more. You can also seek emergency treatment there, and can also seek emergency treatment with a dentist that you may not be registered with. Secondly, we've got an option to be seen at a teaching hospital. So they cover all of the similar things that a general dentist would, but the added benefit is that it's likely to be free because it's provided by either undergraduate students under supervision, or postgraduates, or you're being seen by a consultant, perhaps if you've got a more complex condition. And then finally, you've got options to see a private dentist, and they can provide treatments that you may not be able to get on NHS dentistry. So if you perhaps wanted veneers or a silver filling replaced with a white filling, which we call composite, that would be something that a private dentist may be able to provide for you. And if you needed to find out what sort of NHS practices were available to you nearby, there's this link below, or you can type into Google NHS Find a Dentist. They will show you the location of the dentist and let you know whether they're accepting new patients, because at the moment, not many might be accepting new patients, but the teaching hospitals are definitely open. Next slide, please. So this is just explaining the costs. It's something that comes up quite a lot. I think people are quite conscious of the cost of dentistry, especially in the past. It used to be pay for every item of treatment that you'd receive, whereas now it's banded into the type of treatment that you'd get. So it's £23.80 for sort of your general examination and all of the things listed there. Also emergency treatment would be the same price. Band 2 covers the next stage up, which would include extractions and root canals, and Band 3 covers crowns, dentures, and any sort of more advanced lab work. But then there's also exemptions, which I think quite a few people aren't aware of. So the full list is on the NHS website. Children receive dental care for free. It's also recommended that babies have their first dental check by one, and it's a scheme called Dental Check by One, just to ensure that their primary or baby teeth are coming through properly, and their general health is as optimal as it can be. If you're in full-time education up to age 19, you can also fill out an exemption certificate to ensure that your dental care is free. And then there's also other exemptions that are listed there. There's also an exemption if you have just had a baby, and then up to 12 months after you've had your baby, you're able to have free dental care. And some practices also accept payment in installments, but you just have to make sure that you bring the certificate with you if you are exempt, otherwise you will have to pay. There's also options for dental health insurance. So for example, Bupa or Den Plan, in which you'd pay a monthly fee in order to cover your dental care over a period of time. But these do vary across Scotland, Wales, Northern Ireland, and England. So it's best if you just check before attending. And then looking at sort of the dental team. So we've got the dentist obviously at the heart of the team, creating the treatment plans and deciding on procedures. We've also got dental hygienists and therapists who work alongside the dentist. They work to a prescription that the dentist provides, and they're able to do things like cleaning, treatments for children, sometimes extractions on children. And then we've also got the dental nurse who is working within the actual surgery with the dentist at the time, assisting the appointments and taking medical histories. Okay, and the next slide. So then the final take-home message is just your health, you're in charge. I feel like I've had a lot of patients tell me, you know, even maybe 10, 20 years ago, they'd go to the dentist and they might feel that the dentist is telling them what they feel is best, whereas now we're taught to have that conversation with the patient and decide what their expectations are, what their hopes are, and how we can manage that. And if you feel, you know, you need a second opinion, or you're a bit conscious of how the dentist might recommend the treatment, it's just to say that, you know, you're in charge of your health. If you're feeling anxious, let the dentist know. They might be able to accommodate a bit more time for you, or adjust their techniques, or provide different treatments. There's also a link at the bottom just for patient advice. If you've got queries or maybe complaints that you'd want to put forward, or even positive feedback. And yeah, just to be in charge of your health. It's your smile. So yeah. And then just a final quote to say, a smile is happiness you'll find right under your nose, and the take-home message again, to be proud of your smile. All right, thank you. And we've got just, if you had any feedback or any further questions, you can email us at buddingblackdentist@gmail.com, and we're also on Instagram and LinkedIn and Facebook. All right, thank you.
Thank you so much, Jada and Simi. That was a great presentation. I definitely learned something. I think some of us are going to have to swap our charcoal toothpaste out for something else now that we know maybe it's not the best thing for us. So as I said before, there will be time at the end. And there's lots of questions in the chat about different toothpaste and toothbrushes and different things like that. So there'll be time at the end to answer those questions. So thank you so much, Simi and Jada, for that. Our fourth and final speaker is Dr. Zara Nortley. Dr. Zara is a dentist and an advanced medical aesthetics practitioner. She works in mixed practices in Manchester. She graduated from King's College in 2013, and she was the joint winner of the AM Clover Award for being best demonstrating the Dental Institute's motto, which is "It's better to give than to receive." So the heart of her work is kind of giving to others, and we're really happy that she's taken time out to present to us this evening. She'll be presenting her talk. Is called "An Ounce of Prevention is Worth a Pound of Cure." So Dr. Zara will speak 15 minutes and then we'll go into our question and answer section.
Okay, thank you for having me. First and foremost, thank you for the introduction as well. It makes me feel really special. Lovely to meet you. I'm just going to be putting on my presentation. Give me 1 second. Oh, it was on the right one. Okay, so here we go. World Oral Health Day. Okay, lovely to meet you all. I'm Dr. Zara Nortley, and I'm a dentist, a general dental practitioner / associate dentist. And all those mean the same thing. General dental practitioner is just the dental version of a GP. An associate dentist means that I'm a self-employed dentist working within someone else's practice. I qualified, as I've already been introduced, I qualified back in 2013 from King's College London. Where I also co-founded the KCL Smile Society. So that was a student-led group that went into schools and held workshops to teach kids about dental health, how they can prevent problems at home, and also just to try and alleviate some of the fear of the dentist, because I've noticed that that is a really big thing. I didn't actually want to be a dentist at first. My dad's a GP and he almost put me off really. But I realized that it was a great combination of my love for, or my desire to want to help people, and my love for arts and crafts, and yeah, I really enjoyed clay work at school, and also just making a difference in the community and being part of the community. It's really important to me. So I work in NHS and private dentistry and dental practices in Manchester now. And just to touch back on something that Jada said, so yes, you can see an NHS dentist or you can see a private dentist, but essentially we are the same thing. I am an NHS dentist on a Monday and a Wednesday, and I'm private for the rest of the week. And all that means is that we can offer certain treatments through the NHS at subsidised rates. And then other treatments are only available, well, as they're more cosmetic, they're not available as on the healthcare service. So they are available for private care, such as tooth whitening, such as cosmetic veneers, and all those other fun stuff. General practice in both the NHS and private involves checkups. We do fillings, gum treatments, extractions, including wisdom teeth, and it's actually quite common that I'll have patients that come in and say, what, you're going to take out my wisdom tooth? And I'll say, yeah, it's just technique, really. And we do root canals, crowns, veneers, dentures, and drain abscesses. We do the full lot. Continued professional development is something that's very, very important within dentistry. I've continued to kind of build my skills in general skills also, but my particular interest lies in facial aesthetics. So that's the use of dermal fillers to kind of enhance people's faces and make them feel a bit more like how they used to. I typed in scary dentist on Google and this is the image that came up. And I think it's quite relatable. A lot of us, or a lot of people, think that seeing the dentist is going to be something absolutely horrific. I couldn't even tell you what is in his hand. It's not anything that we use as dentists. Dental anxiety is pretty common. My mum is terrified of seeing the dentist. She always has been, and she's even scared to come and see me, unfortunately. But is it the dentist that you're afraid of, or is it the treatment? I'd say it's probably the treatment. It's the idea of, it's the fear of the unknown, and the fear of maybe needles or something.
Sorry, Dr. Zara, sorry to just interrupt you. I think we can't see your presentation.
Oh no!
Is it coming up on the screen? Sorry, we didn't realise we can't see the presentation.
No problem. Well, I hope you've enjoyed the sound of my voice.
We have. There's lots of really good information. We couldn't see the screen.
No problem.
I didn't realise at the time that.
No, don't worry at all.
Sorry, everyone. Just a few technical difficulties. But just give us a couple of minutes.
Here we go. Are you seeing something now?
Yes, we are.
Okay.
Yeah,
so,
great, fantastic. We're seeing lots of things.
Let me just show you the scary dentist, seeing as you're all here now. It's worth it. That's the scary dentist, but life really isn't like that. So yeah, fear is often of the treatments and the unknown. Believe it or not, we actually want you to be healthy. So when you come in for your checkup, we want to be able to tell you that everything is great. And a common misconception is that aging equals tooth loss, but it doesn't. Quite often, I mean, things have changed and there's a lot more preventative information out there nowadays. And so you don't have to be 85 and have your teeth in a jar. It's not a thing. There is quite possible to get through life without ever needing a filling, without ever having loose teeth, and without ever needing false teeth. So back to the title of my presentation, an ounce of prevention is worth a pound of cure. And that's from Benjamin Franklin. So essentially, dental diseases or oral diseases are divided into three sections. They're diseases of the teeth, diseases of the gums, and diseases of the soft tissues. Tooth disease is effectively decay. So the kind of sequelae of dental decay is fillings, and then you can end up with an abscess or an infection, which leads to either something like a root canal treatment or an extraction. And the simple way of avoiding, I say simple, it is pretty simple. The best thing to do is to reduce your intake and the frequency of sugar. And quite often people don't realize that healthy sugars and healthy foods can be just as dangerous as having a tube of Rolo sweets or, I don't know, a Mars bar. So you've got things like fresh fruit juice, honey is quite popular on cereals and on porridge, dried fruits. I have a lot of kids that come in with dental caries and their parents are shocked because they eat nothing but nice, healthy snacks. And what healthy snacks are they? They're raisins, and raisins are the worst thing ever because not only are they very sugary, but they're very sticky as well and tend to get stuck in the grooves and teeth, causing decay. There are ways to not have to cut them out of your diet or cut these healthy sugars out altogether, but if you can limit the risks by having them near a mealtime. So if you want to have a cake or have something sweet or a fizzy drink, if you have it with a meal, it's a bit safer because your mouth is naturally producing more saliva, and the saliva acts as a buffer to help to neutralize the acids, which in turn prevents dental problems. You can use a straw. So if you do have to have a fizzy drink or you're having a fruit juice, use a straw. It stops it sloshing all over your mouth. Fluoride. So the dental students touched on fluoride. Fluoride is not bad. Fluoride is actually wonderful in the prevention of dental decay. In the 1960s, it was eventually added to toothpaste. And the rates of tooth loss and dental problems really reduced so dramatically. My mum's generation of Jamaicans are really big on Euthymol, that pink toothpaste. And it doesn't contain any fluoride at all. So it's an antiseptic, and we like that kind of tingly feeling it gives, but we need the fluoride. So if you are a fan of Euthymol, it might be worth switching it out and using your Euthymol in the morning maybe, and then going back to a fluoridated toothpaste in the evening. What fluoride does is it's a mineral, so it's a naturally existing mineral, and it integrates into the outside layer of the tooth, the enamel. And with this being stronger and reinforced, it's far less likely that dental decay can progress into the next layer down, which is the dentine, because once it gets into the dentine, that's when you end up with the sensitivity and the pain. Top tip number 3 is to brush twice a day. And I know the ladies have also told you this already, but twice a day, the national guidelines are that you brush before bed and also one other time. And why is that important? Plaque will develop on everyone's teeth naturally. And inside the plaque are bacteria that turn anything sugary into acid. And when you think about bacteria, they're microscopic, so they don't need much sugar to work them magic or the opposite of magic. So you really, really need to make sure you're removing the plaque twice every day, brushing for 2 whole minutes. So if it doesn't feel like you're brushing forever, you probably aren't brushing for long enough. I think on average, people tend to brush for about 37 seconds. Electric toothbrushes are fantastic in that quite often they have pressure sensors on them, but they also have timers on them, and they make the motion for you. So you can just focus on making sure you're covering each of the surfaces of the teeth that you need to. Also, if you watch Love Island, you don't need to be moving your electric toothbrush around. Hold it against each tooth, let it do its thing, move it along. I hate when they do that on TV shows. It's the worst thing. With manual toothbrushes, you can have the same desired effects. You can brush just as well with a manual toothbrush. You want to use a medium bristle, so you do not need a super hard toothbrush. And you want something quite simple as well. The ones with all the bristles that go all opposite directions can sometimes just be a little bit confusing. Nice, simple, small-headed toothbrush that can get right round all the nooks and crannies and keep everything super clean. Make sure that you're changing your toothbrush every 2 to 3 months as well, because if it's worn, it's just not going to do what you need it to do for you. Second type of disease of the mouth is gum disease. So gum disease can be reversible or irreversible. The reversible sign is the beginning, really. So that's where the gums are bleeding. And I find often with my patients, they'll say, oh yeah, they're bleeding a little bit, and almost make out that it's not a problem. If your eye was bleeding, you would be worried. It's the same with your gums. Gums should not bleed. And most often it's because there's been a plaque buildup. The gums have become irritated and inflamed. And the moment you touch them, they just go wild. So if your gums are bleeding, don't be put off. Just take your time with the brushing more. Make sure you're not brushing too hard, but make sure that you're removing more plaque, and then gradually that bleeding should stop. If you are finding your gums are bleeding, please go and see your dentist and have everything checked out. Because I mean, it could be that you're just brushing too hard and it's trauma, but more than likely it's because there's a buildup of plaque. Irreversible gum disease is when it progresses past that simple stage, and you start to lose the bone that holds the teeth in place. So on top of the gum, or underneath the gum rather, is the bone that holds the teeth in place. And as you lose that bone, the teeth will become loose. And this is not reversible. So to avoid losing your teeth, brushing is essential. Interdental cleaning, as the ladies have also said, is essential. So you can't reach all the surfaces of your teeth with brushing alone. You need to get in between the teeth. So use your interdental brushes. In terms of size, you want something that is robust and enough to, you can feel, it feels snug in between your teeth, I suppose. If it's passing through too easily, it's not going to do what it needs to do. And then the third main condition is soft tissue diseases. So these aren't always dangerous. There can be some conditions that are just there. They're a little bit like eczema of the mouth. You have things like ulcers due to diet. You can have a bit of trauma due to teeth grinding. But if in doubt, get it checked out. That was the Mouth Cancer Month theme this year. If in doubt, get it checked out. So have a look in your mouth from time to time. Check your cheeks, check your tongue, and look for anything. Get to know what you is like and what's normal for you. Sometimes if you do have symptoms in your mouth, they are treatable. Try not to suffer in silence. That's what we're here for. And last but not least, please wear sunscreen. I mean, I know growing up, I didn't ever wear sunscreen. I thought, oh, I'm black, I've got melanin in my skin, I'm protected. But no, oral dentists, we don't just look in the mouth, we look around the face as well, and we're looking for anything abnormal. And quite often in Black and Asian communities, skin cancers go undiagnosed because we're not really, as the general public, we're not looking for them. So please protect your skin, wear sunscreen. So turns out you might not actually be so scared. See your dentist before you need treatment. Let us come and have a look and check everything out. At every checkup, we do a cancer screening anyway before checking your teeth and gums. You might not even know it's happened, but we are. And then if there is anything that we're concerned about, we will refer to someone like Mr. Andi to have a better look. So again, prevention is key, and we're all responsible for our own dental health. Thank you so much for listening. If you would like to know anything else, if you enjoy silly memes about life, check me out on Dr. Zara Nortley on Instagram. Take care. And yeah, I look forward to your questions at the end. Thanks. Stop share.
Thank you so much, Dr. Zara. Again, so much going for. We had so many good presentations. All the presentations have been amazing, and I feel like I've learned so much because as a doctor, we don't do teeth, obviously, and we know a bit, but it's so good to see so many things that are new for us to learn. So we have a whole lot of questions to get through. I'm going to try and ask everybody's questions. I think I will start off asking some of the questions that we had about oral cancers. So starting off with Mr. Andy's presentation. If Mr. Andy's there, just give me a wave or a shout out to let me know that he's around.
Yep, he's there.
Oh, he's there, great. Hello, thank you so much. So thank you so much everybody for sticking with us. We've had some great presentations and we're just going to move on to our question and answer. The first question that is really relevant actually for Mr. Andy is, are Black and Caribbean people disproportionately affected by oral cancers, and if so, why?
I think the data would suggest that Black and African Caribbean people are not disproportionately affected in terms of their risk for developing oral cancer. So, as I said at the beginning of my talk, if you have any of the risk factors, then that would increase your own individual risk. One could argue that there may be a greater proportion of undetected or late presentation of disease because of a lack of a reduction in terms of inequalities in access to healthcare. So by virtue of being an ethnic minority, access to the GP and forward access to a specialist may be compounded in that way. So I think inequalities in relation to access to healthcare in broad terms may affect prognosis because of late presentation, but in terms of the individual risk, there is no data to suggest that is the case.
Thank you. That's really, really good to know, actually. And so one of the other questions that we had was, if one of the oral cancers do not present with pain, what are other symptoms, especially if the cancer is not easily seen from the mouth cavity, so one's found in the jaw or the sinuses? What are some of the symptoms that people can look out for to make sure they're picking up if anything is going wrong?
Yeah, that's a really good question. So one of the common symptoms that I see are if teeth are becoming loose and there's no real explanation for that. Some of our older patients who have dentures, all of a sudden the denture is not fitting properly, particularly in the top jaw. That may be a subtle sign that something is growing and distorting the anatomy and changing the fit. We see bleeding sometimes. If tissues are being eaten away by a cancerous process, the tissues don't have the ability to heal in that same way. You may notice bad breath in a friend or a colleague. That might be a sign of tissues which are also breaking down. So the key thing is to get used to what your mouth looks like, so that if there is any subtle change, you're the one to instigate that intervention to get to your doctor or GP, because pain is only present if the area becomes infected, and by that time it's usually too late. One final thing I might mention is if you get pins and needles of the lip or part of the face, that may be a sign that the cancer is eating away into nerves. And that is something that would also obviously take great interest in diagnosing and imaging.
Thank you. That's a really comprehensive answer. So making sure we're looking at our mouths and knowing what our mouths look like. So that's really important. The next question is, how long does it take to plan out surgery? And how long on average do surgeries, such as the cheek surgery that you showed, how long do they take?
Oh, that's a really fantastic question. So I start planning surgery as soon as I see the patient, in essence, and that involves staging the cancer in the first instance. And by staging, what we do is do some imaging, the CT scans you saw, MRI scans, and that allows me to understand the extent of the cancer and how far it's spread. So that planning process can take, well, normally I'd have only 2 weeks in total to do it. And that means manufacturing any custom implants or custom plates, because we don't want to delay the surgery as we're dealing with the cancerous process. In terms of the surgery, surgery usually involves 3 aspects. That's removal of the cancer, clearance of the glands in the neck where the cancer may spread to and reconstructing the defect. So complex operations where I'm reconstructing with bits of tissue taken from other parts of the body because the blood vessels need to be stitched under the microscope at 25 times magnification. That's with stitches which are finer than your hair. These operations take anything from 6 to 7 hours to 12, 14 hours in total. So they are long operations in that regard.
Wow, 12-hour operation. I can't imagine doing that. It's a lot of dedication. Thank you for that answer. We've got a few more questions that are to do more with general dentistry, and we've got a couple more that I'll come back to, maybe Mr. Andi at the end, but thank you so much for those answers. So then the next kind of set of questions I'll probably split up between Zara, Simi and Jada. And the first question is, what type of toothpaste should you be using? I've heard that fluoride isn't that great, but you guys already answered that. And is baking soda better? So maybe if Simi or Jada could answer that. So what type of toothpaste should you be using, and is baking soda better than fluoride?
I'll go for it then. So as Simi sort of mentioned in her presentation, any fluoride toothpaste is probably the best. If you look on the back of the packet, it will tell you how many parts per million fluoride is in there. Also for children, I think it's above the age of 8, it's best if they're actually using adult toothpaste rather than child toothpaste. Between the brands, I think the ingredients might vary slightly, maybe if you don't like a certain taste of toothpaste, but the most important part is the fluoride.
And is baking soda bad to use, or is it okay to use baking soda, or can we so toothpaste like Arm & Hammer that have baking soda, is that fine? Or because I think we mentioned that charcoal is abrasive, is baking soda abrasive in the same way, or can we use that?
Yeah, I'll pass that on to Zara or Simi.
Yeah, Zara or Simi. Okay, Dr. Zara. Yeah, if you can answer that, that'd be really good.
Okay, so baking soda will probably make your teeth quite sensitive, and sensitivity really isn't pleasant. So take it easy with the baking soda. I know a lot of people use it for whitening, but yeah, avoid.
Thank you for that. So thanks, Jada, and thanks, Zara. Oh, I'm muted. The next question that we have is, what toothbrush would you recommend? I've used an electric Oral-B, but I've heard Philips is also good. So maybe Zara could answer that?
Sure. So as long as you're using a toothbrush is a good start, to be honest. I'm a big fan of manual toothbrushes. I think you can do a great job with a manual toothbrush as long as you're willing to put the effort in. So you need to make sure you're covering all the surfaces right around the front, right around the back, and then the biting surfaces as well. Take your time, gentle movements. Make sure you're using circular motions. You want a toothbrush that's small enough to get right around the edges.
Thank you. And the next question is for Jada, or somebody could probably answer this. You guys mentioned interdental brushes. So the question is, where can we buy interdental brushes from? How do we select them? And then are they reusable?
I would say your local supermarkets. Asda do it, Morrison's. So the big ones, I would say. And also, if you ask a dentist, they should have some as well. But I'd say the best fit, I think Zara spoke about it, but if it has a snug fit, so if it doesn't just go straight through, because it's not really going to scrape the surfaces of the teeth. Yeah, I don't know if you can see it, but yeah, if you just imagine a gap, you need it to scrub one part of one tooth and then the other part of the other tooth. So yeah, just make sure you have a snug fit, I would say. Yeah.
Okay. Thank you. And the other question was, are they reusable? So can you use an interdental brush more than once, or do you have to like throw them away afterwards?
Yeah, I would say it's a bit like a toothbrush. So I think you can, and then you just have to wash it away so you're not putting the plaque back where you cleaned it off from. But I would say, yeah, definitely wash it underwater and yeah, change it. I would say when it's getting worn, I don't know if Zara can correct me, but when it gets worn.
I was just going to jump in there. So yeah, you can use the brush a few times. I'd say use each brush for maybe 3 to 4 days, and then switch on to the next one. And when you're looking for the size, just ask your dentist. We've got lots of ways of working out what kind of size you need, because there's a difference in a tenth of a millimeter between sizes. So you want something as big as possible.
Okay, the next question is about flossing. So is using a water flosser better than using an incidental brush? And is water floss as good as like normal floss? So I don't know if anyone has seen like water flossers. They have this little jet of water, and you can buy them and use it as floss. Are they as good as normal floss? Are they better than incidental brushes? Should we be using water flossers?
I found personally that my patients get better results using water flossers, not necessarily because of the device itself, but because it's something that they've invested time into, and it's something that the kind of the fun of it makes them use it, whereas flossing or using dental brushes just isn't as exciting. So they tend not to do them. So that repetitive, yeah, adding it into your schedule or your habits, that tends to get the results.
Great, thank you. And then maybe Jada and Simi could answer this one. Can you floss too far or too deep? I worry that I will pull the gum away from the tooth and then food might get stuck there.
That's a good question. Sorry, Jada, do you want to
answer? Maybe, yeah.
Yeah, sure. I mean, technique-wise, I think it's something that maybe we could be taught at school, even because I think Americans are taught it more than in the UK. Something that we're taught at dental school is if you actually wrap it say around your middle fingers, and then use these fingers to sort of guide it down gently, rather than just holding it taut and pushing it straight down between the teeth. It's a bit easier to control and less likely for you to make your gums bleed. So it's a technique that people could try.
Is there anywhere that people can like go to find to like watch for good floss technique, or?
I guess on YouTube, but even if I had some floss here, I'd show everyone. But it's literally if you were to wrap it around another finger and then use these fingers to help guide it down, it's a lot easier.
Okay, great. Another question about interdental brushes. Can interdental brushes be used if you do not have gaps between your teeth?
Yes, so there's thin ones. There are quite thin ones. I think it's usually the pink ones. I don't know if it's universal, but yeah, there's really small ones. Yeah. Sorry, I'll just say for some people they have crowded teeth. So when it's really hard, when you really can't get the interdental brush in, I would say floss, try floss as an alternative. Yeah.
Thank you, Simi. And so this question is a good one. How can you tell the difference between dental abrasion and plaque? How can dental abrasion be reversed? Maybe Dr. Zara, if you can answer that question.
So abrasion is the loss of surface tissue. So abrasion lesions tend to be a little bit yellower or a little bit brown even. And you can notice like a little missing wedge from the base of the tooth, whereas plaque is soft, it brushes off, it's kind of yellow in color. And as if plaque stays around for a long time, it does harden. So you can't remove that with a toothbrush. So you would need to see your dentist or see a hygienist. Abrasion, unfortunately, you can't get the tooth tissue back. So once it's gone, it's gone. But it's possible to have white filling material placed into those areas if they are particularly sensitive, especially. That's something that might be available on the NHS. If they're just a bit unsightly, then it's worth speaking to your dentist about as a more of a cosmetic treatment.
Thank you. And then a question about darker gums. So a lot of Black people have darker gums. Someone's asked, is it normal for your gums to change colour, so to be darker when you're younger and then become more pink after a number of years? Is that something you should be worried about, or is that normal?
So I'd say it's probably quite normal. So the pigment in our gums is the same pigment that's in our skin. In the same way that you may develop a freckle, for example, the tissue in your mouth turns over time. It's not the same gum that you've always had. So those cells will regenerate, so to speak. If your gums are particularly pink, though, it might be a sign of gum disease. So again, get it checked out. If it accompanies bleeding, for example, yeah, have it looked at.
Great, thank you. So the next question is, maybe Jada and Simi can answer this one. Do all dental schools have a teaching hospital? And can anyone go to a teaching hospital? Is it the same payment structure as going to like a general NHS hospital?
As far as I understand, I think there's maybe 15 universities across the UK that teach dentistry. They either have their own hospital associated with the university, or the students practice as part of, you know, a hospital trust. In terms of being able to be seen there, I think patients usually are triaged first, so they go to an initial appointment and they sort of create a treatment plan for you. I think one of the questions I saw earlier was, do you need to go to a dentist if you have good teeth? And I think it's not always about the teeth. It can also be related to, you know, your gum health. Even if you know, you think that you've not got any problems when you're brushing your teeth, it's best to go to a dentist, you know, every 2 years or so. Just for that peace of mind, and for them to sort of update you in terms of what you may be able to improve at home in terms of brushing. But it should be a case that everyone should be able to be seen and triaged at least, and given some advice, even if no treatment needs to be done.
Thank you. Another question maybe for Simi. I don't know about answering this bit. It says, is it true that dental students get free electric toothbrushes and free dental care? So I think people want to know.
So funny. My school gave me free electric toothbrushes. I'm not too sure about everyone else, but I was given one.
Yeah, me too.
Yeah, I'm not too sure about other dental schools. Oh, I think Zara said she was given one as well. Yeah, I think most of us are, but I think it's to promote electric toothbrushes to our patients. So, you know, if we've tried it, then we can advertise it.
Yeah, I think just to clarify, I don't think they're regularly just giving out free electric toothbrushes to dental students all the time. Great, thank you for answering that. The next question is it normal for your gums to bleed when you first start flossing? Do your gums need to get used to flossing?
It's not so much that your gums need to get used to them, but if you think about it, if you've never flossed, then you're going to have a fair buildup of plaque. Your gums are going to be a little bit irritated and a little bit inflamed. So that's why they're going to bleed when you first start. As they get healthier, that bleeding will stop, or it should stop. So that's why it's almost as if your gums have got used to them. But no, they're just healthier gums.
Okay, great, thank you. Is it normal, what is the average age that people start to lose teeth? Is losing teeth a part of the natural aging process? Should we expect it to keep our teeth into very old age if we care for them properly?
Yes, keep your teeth. I'm sorry, I couldn't help but jump off mute for that one. I have an 80, I think she's maybe 83, full set of teeth, and it just comes down to diet, brushing, and looking after them. So I think, unfortunately, there's not so much, or we're not encouraged so much to take responsibility for our own health quite often nowadays. And it really is as simple as that. I understand it's not simple, but stay on top of your health, make sure you're following the preventative advice, have checks from time to time, and there's no reason that you shouldn't keep your teeth until your old age.
I'll add to that, in that I had a patient who was 102, I saw about a month ago, and she had a full set of teeth, not a single filling. So there's no reason why teeth should be falling out before you're 102 at least.
Wow. I feel ashamed now. I'm not going to tell anybody how many fillings I've had, but I've definitely had more than one. So it just goes to show that it's all about the care that we've talked about tonight. Okay. Actually, another question actually I can ask for Mr. Andi that wasn't asked before, that I didn't ask before, was, is there any research into how to make patients comfortable during surgery? So I think that's questions about, I guess, pain relief and anesthesia during surgery, and maybe you could just tell us a bit about that.
Yes. Perhaps it might be worth talking to the questioner, because this I'm not sure which angle they're coming from. So because under general anesthesia, especially for long operations, there is a complex monitoring that's happening. So, for example, we use a lot of invasive methods to measure the blood pressure, as well as the oxygenation of the blood, and things like brain activity. These are all measured during long anesthesia. Of course, all the muscles are relaxed and breathing is taken over by the anesthetic machine. The patient is unconscious. So that's probably as comfortable as you can be with no evidence of pain stimuli during the procedure. So I wouldn't worry about having a general anesthetic and not being comfortable, because by definition, when it's done correctly, and it's, we have over 120,000 anesthetics given every year in one hospital without any incident. It is very safe. You're not going to wake up during the procedure, and you're not going to feel any pain during the procedure, and therefore comfort is really not an issue in the 21st century.
Thank you for that, Ms. So I think the key thing is don't put off going to your dentist or going to see your GP about something you're worried about because you're concerned about pain, because that's something they're very experienced in managing. And the next question is, does hard or soft water make any difference to your teeth? So for example, to plaque, does it make a difference what type of water water's in your area, so like hard or soft water?
It can do. So if plaque is left behind in anyone, it will turn into calculus, which is the hard stuff that you can't brush off. And typically, if you are going to get a buildup of calculus, it will be around the lower anterior teeth, which is where your salivary glands are. So it hardens much sooner because there are more minerals around that area. I guess on that train of thought, you could assume that in harder water areas, your plaque will turn into calculus sooner. But if you're brushing effectively, you shouldn't end up with any calculus.
Thank you. Another question maybe Simi or Jada could answer again is, can you reverse tooth decay at home? So maybe, yes, Simi can answer.
Yeah, I would say the earliest signs of tooth decay, that is known as like white spot lesions. So you might get a whiter kind of chalkier surface on your teeth, and I would say that could be reversed with fluoride, so the fluoride in toothpaste. I would say definitely go to your dentist and they can give you a more concentrated version of the fluoride, and I would say that would help do the job. But the later ones, the later kind of decay, so the ones that have a cavity, yeah, that can't be reversed at home. I would say you'd need a filling or something. Yeah, I don't know if anyone wants to add anything, but yeah.
Yeah, I think everyone's nodding, so they agree. Another question, I mean, maybe I'll direct it to Jada because we talked about floss earlier, but are placker flosses, so the ones that are the floss on the stick, are they less effective than other types of floss, or is it fine to use the individual ones on a stick?
I think is it like sort of the flossing harps? I've seen those before.
Yeah, I think that's what
I guess maybe the thickness of them is a bit thicker than you would with normal floss, just because it is held within a plastic holder. I mean, it can be beneficial for people who maybe have mobility problems in their hands, or just find it a bit more difficult to use the floss, the regular floss. But if it's removing plaque from the surface of the teeth, then it's better than not using any at all, I'd say.
Great, thank you. Another one maybe Zara can answer is, how do you remove tooth stains?
Oh,
Yes,
sorry. Tooth stains. So you can see a hygienist. So a hygienist can perform a stain removal procedure for you, using like a water jet or type equipment. Otherwise, you can think about tooth whitening. So tooth whitening involves making some custom shaped trays for you, and your dentist will prescribe a course of gels appropriate to what your needs are, essentially. Usually you wear the gels for about 2 weeks, either overnight or for about 2 hours each day. And they will make your teeth whiter and remove the stains for you.
Great, thank you. Another question, so we've got a few more questions, but we're coming close to the end, because I know everybody's maybe a bit question fatigue now, but the last few questions that we have. So what is the best type of mouthwash to use, and should we be using it at all?
Do Simi or Jada want to go for that one?
I don't mind. I've completely forgotten the concentration, but mouthwashes with fluoride would be good. That usually has the content, the fluoride content at the back in the ingredients section as well. And I would say you shouldn't use mouthwash right after brushing your teeth. Use it maybe after a meal or one other time during the day, but not what can I say? Yeah, not after brushing your teeth, because literally all the good stuff that you did, all the good stuff you put on your teeth after brushing your teeth, basically you're washing that away with the mouthwashing. So yeah, I would say mouthwash with fluoride would be good.
Great, thank you. And then Jada, can I ask you, what can you do for newfound tooth sensitivity? So if you're getting sensitive teeth, is there anything that you can do?
Yeah, first of all, visit your dentist, obviously, discuss it with them. A lot of people tend to use brands like Sensodyne. They've got certain ingredients in there that help with the sensitivity. Your dentist could also see if there's any sort of underlying cause to the sensitivity, whether you've got, say, tooth wear and it's sort of thinned out the enamel. They might be able to put sort of a sealing material over it to help with the sensitivity as well.
Great, thank you so much, Jada. I think Mr. Andi has to go. So I see that.
Yes, thanks so much for the invitation, guys, and what a fantastic session. Well done to the team for putting it all together. Had some great questions as well. I can see the questions about careers, medicine or dentistry. I'm happy to take any questions about that via email as well. So have a great evening and happy World Oral Health Day.
Thank you so much for joining us and for your presentation, which is excellent. And as Mr. Andi said, if you have any more questions about careers, we can try and get you in contact so that you can ask those. Thank you. So we've got our last couple of questions. This one is kind of follow up from the mouthwash question. I've seen some videos on YouTube about reversing gum disease using gargling olive oil and other oils, and kind of people from the Asian subcontinent sharing an Ayurvedic method of using turmeric on the gums. Are you familiar with any of these methods? Do they work in helping with gum disease or in improving oral health? I don't know if Zara can answer that.
Yeah, I think Zara, yeah.
So the way of fighting gum disease, it is to remove the plaque. The plaque causes the gum disease. The plaque sticks there, the bacteria sticks there, and the gums get irritated. What gum disease is, it's essentially a battle between your own immune system and the plaque. And what happens is your immune system almost mounts like a war against the plaque that's there, and in doing so, it causes more destruction, which leads to the bone loss. Turmeric does have anti-inflammatory qualities to it, but really I would stick with using your interdental brushes, removing the plaque, removing the cause of the irritation and problem, and go from there. And there are other contributing factors to the progression of gum disease, such as poorly controlled diabetes, for example, stress, smoking. So limiting those other factors as well, improving diabetic control, for example, would be great. But I wouldn't recommend anyone uses just an adjunct without doing the actual work that's going to get rid of the gum problem.
Great. One question that we really wanted to make sure we got everyone to answer is what advice you'd have for somebody who is wanting to apply for dentistry. Also, any budding dentists in the chat you're watching, what advice would each of you have? So maybe if I go from Jada to Simi to Dr. Zara.
Firstly, I'd say do your research, try and get as much work experience as you can. I know it's quite difficult in the pandemic at the moment, but I know a lot of people are doing sort of online courses. There's a really good one on futurelearn.com run by University of Sheffield that tells you a lot about what dentistry is like. Speak to dentists, you can message us via Budding Black Dentists. Quite a few of us are also on LinkedIn. Just to get that sort of personal experience from the undergrads and people who have qualified. Just explore the career fully.
Thank you. And then Simi?
Yeah, I'll just say, I'll say especially for African and Caribbean dental applicants, I'll say just a word of advice: don't be deterred if you're the only person who looks like you in, you know, waiting for your interview or in your school applying to dentistry. I would say if you want to do it, go for it, and don't let what anyone says deter you. If you know you can do it, if just have faith, I would say, just have faith in your abilities and your capabilities. And some people need to see role models as well. So I would say look out and find some. There's a Budding Black Dentist if you just plug the platform there. But yeah, I needed to see role models. So I made sure I did work experience at a Black owned practice. I spoke to dental students who had gone from my sixth form to a dental school. So also, yeah, just reach out to people. But I would say dentistry is a vigorous process to get into, as in the application is vigorous. There's the UCAT and everything, but just persevere. And I would say in terms of the dental schools you want to apply to, check their entry requirements, check that you are able to do what they're requiring basically. So some schools may require 2 weeks of work experience. So if you can get the 2 weeks of virtual work experience, that'll be good. Just make sure you're meeting all the criteria that the schools want you to meet. But yeah, if the application process is getting hard, just reach out to people. Other than the Budding Black Dentist, there's the ACDA, so they're the African Caribbean Dental Association. But people in general, whoever's wanting to apply to dentistry, I'll just say reach out to people, talk to dental students, and talk to dentists if you can. But mainly dental students, because they're closer to you in terms of getting into dentistry. So.
Just following on from what Simi said, yeah, speak to dental students, because I have to admit I applied for dentistry 13 years ago, so I'm probably not all that up to date with the ins and outs of it. But yeah, apart from meeting all the criteria, so your grades and desired work experience, remember that dentistry, yes, it's a medical and scientific career, but communication is key. Like every day you're building relationships with your patients, and they need to trust you, and they need to understand what you're saying and understand clearly and be able to consent to the treatment that you're offering them. So you need to be able to communicate, and you also need to be able to work as a team, because I would be lost without my nurse, honestly. One of my nurses, she can read she reads my mind. She's got something before I've even thought that I needed it. So you need to be a team player. Sometimes we're running late, your colleague might take over from one of your patients, or you grab one of theirs, or you're all part of the system. But yeah, reach out to people, get in touch with the Budding Black Dentist, which I think is wonderful. There's nothing like that when I was applying. Also AC Medical Mentors, Afro-Caribbean Medical Mentors, because they'll be able to guide you through the application process as well, which is really important. I think when I was applying, what I do know is that I wasn't entirely sure of what I needed to do to get the place. So yeah, make sure you're up to date with everything and go for it. Don't be put off. We're all here. We're doing it. You can do it.
Thank you so much, everybody, for sharing that. So much inspiration for us, isn't it? Like anybody who's a budding dentist, you have so many role models that you can look at. So that's great. Our last and final question is probably a fun one. So you guys, everybody might have seen some of these rappers with like grills on their teeth, and we have a question about whether grills are bad for our teeth. Is it okay to get grills? Are they bad for the teeth? How do people get them? How do you take them off? I don't know if anybody knows the answer.
Yeah, so grills aren't actually bad for your teeth. Grills don't, why do I know this? A grill is, we take an impression, we have something cast, and it literally just fits over the teeth. So it doesn't involve cutting the teeth or damaging them in any way, and you can pretty much have them made however you wish. There's a guy in Birmingham that makes amazing ones. Not to plug anyone, but yeah, it's a simple, straightforward procedure. And at the same time, get a checkup, have a checkup, and then have your grill, and you're sorted.
Thank you. That's a great answer. So just to close, is there anything that each of you would like to kind of end on to let everybody know before we finish up. So maybe final words of advice or wisdom. Maybe start with Jada and then Simi and Zara again, as we did before.
I just say to everyone, don't be afraid of the dentist. We're not as scary as people think. Just come and have a chat, see what they have to say. You're in charge of your own health as well, so don't think it's out of your control. If anyone wants to apply to dentistry, obviously get in contact with us. I'm sure I'm happy to, and Simi as well, and a lot of the budding black dentists happy to sort of mentor people into getting into the profession, because it is a really rewarding profession. It's art, it's science, business management, everything. So yeah, and thank you very much for having me.
Thank you for coming. You were fantastic. Simi.
I'll just add on to Jada. I knew that dentistry involved a lot of things, so the business management and stuff, but it also involves artistry. I'm not even an artistic person, but it's fun to learn. It's fun to learn all these new skills and everything. And yeah, it's definitely rewarding. It's challenging, but rewarding, because once you get the hang of things, it's definitely, what can I say? It brightens your day. And yeah, reach out to dentists, dental platforms, if you want to apply to dentistry. But yeah, definitely consider it, I would say. And also in terms of the oral hygiene instructions and everything, yeah, just think, like, in terms of habits you have, is this ruining my teeth? Because I'm sure there's stuff I haven't even covered in my presentation, but I know there's some habits that are quite bad. I'm even looking into research regarding chewing sticks, and I had an argument with my dad in terms of whether they're good or bad, because I know a lot of Africans chew sticks instead of brushing their teeth. I'm going to do research on that. And yeah, just the internet, I would say beware of the internet, but definitely talk to your dentist. Dentists are there for a reason. Visit your dentist as well, not just when you have pain or when you need a root canal. Yeah, visit your dentist just for a checkup as well. Yeah, I think I've covered all bases.
Thank you, Simi. Thank you for coming. And Dr. Zara, just to finish off.
Final words, I guess, if you are scared of the dentist, the best thing to do is to avoid needing treatment. So do everything you need to do at home, come in for a checkup. We'll send you away with some good news, hopefully. So yeah, avoid the sweet things, brush twice a day, and keep healthy. And thanks for listening.
Thank you. So thank you everybody so much for coming. We really, really, really appreciate when you come out and support. We know you don't have to attend these things. And so thank you so much to all our speakers. All been amazing and been so helpful in answering questions. And thank you all for attending. We don't have these talks if it isn't for the people who attend. So we thank you so much. And we just want to remind you of where you can find us. So you can find us on our LinkedIn. You can find us through our Instagram page. And also Budding Black Dentists, you can find them through their social medias as well. We've got Twitter, we're on Instagram, we're on Facebook. And also finally, this is a voluntary organisation, so everyone who takes part in these, we do it all voluntarily. If you would like to donate, we have a link to our PayPal that should be in the chat. And if not, contact us on any of our social media or sites, or email to if you'd like to donate. We really appreciate all your donations and help. It really helps to support this organisation and the work that we do. We know that Black, British, Caribbean and Africans, we're underrepresented in lots of different areas, especially in healthcare. And this is all part of our work to help our community and give us the information that we need to live happy and healthy lives. So thank you everyone for coming, and please keep an eye out for our future events. Have a great evening. Bye.
Yes, I met a girl this morning. She was love at first sight. I met a girl this morning. She was beauty to my eyes. I asked her where she from, she tell me in the tropics. She asked me what's my name, I tell her I am Connie. And I said, girl, tell me what's your name. And she tell me that her name is Jamaica. And I said, smile, girl, smile. Jamaica. And I said smile, hey smile, ooh Lord, smile for me Jamaica. Whenever you cry, here am I. Yeah, I'm here for you Jamaica. Dry your eyes, girl smile, smile for me Jamaica. Lord, hey, she has a registry, a beautiful woman with the sweetest gifts. Beautiful sunrise and an evening kiss of a nice sunset on the evening season. But she tell me say she tired of the exploits and the liars. She give them reggae, give them beaches, give them flowers and the ferns. All she got is abuse in return. But I say, don't you worry yourself, mama. Hey, chronics is here to your help, mama. Ooh, I said no worry yourself, mommy. One thing me I beg you do for me. And I say smile, hey smile, smile for me Jamaica. And I said smile, hey smile, hey smile for me Jamaica. Never you cry, here am I. Girl, I'm here for you Jamaica. What must I try? Oh my, she asks me, and this I want me say. A sweet, sweet chronics, you give them. The one drop beat pan a rhythm. Are you give them bop with a different stepping? Are you give them gold, nobody can run them. Oh, but see ya, them must think say you're out of ideas. You give them art and street literature. You're gonna make the world see the better picture. I said no worry yourself, mama. Chronics is here to your help, mama. Hey, I said no worry yourself, mommy. One thing me I